Hi, so I wanted to show you a technique that might save you money and help you express blockages in your Meibomian glands, your eyelid glands. So if it's on the top, do it on the top. If it's on the bottom, do it on the bottom. Or do both if you want to help the whole eyelid circulate fluids. Pinch and roll the skin and roll all the way to the edge of the eyelid. And you can close your eye and do the top. And just keep doing that in a circle. It's not exactly flattering, right? But you get the point. And so the goal with that is to really push up and down so that the glands are respectively expressing the fluid. And it's, they have those clamps. I looked it up. They have the expressors. Those are necessary, but I would really only allow an ophthalmologist to use those tools so that if something were to go wrong or if the gland was injured, they would have the resources to make sure that the vision was protected. So this is a safer way to express the gland, and also to see if there's look for a root. That might be a little gross to think about, but there's usually a root if there's a stye or if there is a Chalazion, and you want to kind of work that and express that. And it's best to do this after a hot compress when the fluids are less congealed and they can move out of the gland. So remember, just pinch and roll on the afflicted eyelid. Ideally do the whole eyelid, and do this multiple times daily, so long as you aren't irritating the eye. Well, I hope that helps you, and I hope it saves you money.